So then I made notes so that after school, when I was reviewing for the board exam, I was able to use some of those notes too. So I made my own notes, and then the highlights. In the book, they have some highlight section. They also have had a question bank at that time. And you rest when you are tired. You don't want to really just keep on doing to where you are not understanding anything, like you are reading for the sake of reading. Be mindful that the questions are not there to trick you. And then by the time I understand what the question is asking me, then I have my answer in my head.
Nursing with T. Get all the tea on nursing.
Welcome to our channel. My name is Miriam, nurse practitioner. Today we're going to talk about success secrets for your nurse practitioner clinical rotations. What are some of the success tips that you need when you start your clinicals for your preceptors? Because mind you, that clinicals is the big part of your education in order for you to graduate your nurse practitioner program and take your board exam. So the first thing I would like to recommend is that you come prepared. What does that mean? Make sure you review the charts. Sometimes you even come in before your preceptor or that nurse or the doctor comes in, so that you'll be familiar with the cases schedule for that day. Familiarize yourself with the facilities, policies, and procedures, how they do things, and what is expected of you as a professional. Demonstrate a professionalism. You dress up appropriately, if they want you to dress up lab coat and all that. Make sure you do that with your name tag and everything. Arrive on time. Your chewing gum. Some of these tips are very simple but very important. You want to show that professionalism all the time. You're already a professional anyway, right? You're a nurse. So you want to make sure that you are very professional when you come there. And then communication. Practice to listen actively with the patients and your co-workers, because the preceptor is watching for those things. Are you listening to your patients? When there's someone, don't be quick to talk. Listen to the patients, let them talk. And also make sure that you articulate your findings, assessments, and your treatment plan. It depends on what your preceptor prefers. Some would love for you to just come in the room with them. Some would say, okay, go and check the patient out, come back, give me a report, tell me your plan of treatment, and then we'll go from there. And be receptive to constructive feedback. Don't take it personal that, they're attacking you. Because if you are making mistakes, but the preceptor is not saying anything, then they're not helping you, right? Because the goal of clinicals is that you are learning so that you go out and practice on your own. A building relationship. Make sure that you collaborate. Even when you go there are some clinicals that you go there, you also be working with other medical students or other nurse practitioner students. So you want to make sure you collaborate with them. You are a team player. Same thing with the nurses that are working there, the medical assistants that are working there. Because mind you, when you are clinicals, most of the time you can be auditioning for a job, because if you like the place and they already know you and they can vouch for your professionalism, competence, you want to look for a job there, you have no problem. But when you go there and you are loosey-goosey, chances are they might have a position, but you may not be the candidate for that job. So you want to build those relationships. Make sure you hone your clinical skills. You are reading all the time. You are researching topics all the time. For instance, you are at work today and the patient came in with a condition that is a little bit complex. After you finish the school, finish taking care of that patient, when you get home, you read. You go back and research on that topic. And then if you have any questions, you come back and talk with your preceptor about that. Oh, and by the way, some preceptors will also give you homework. I know my primary cares, both of them will give you homework on topics to research. So don't just let that go. Don't come with excuses the next day. Make sure you research them. And also, by the way, by the time you are working there you are there for a few days, you would know pretty much some of the conditions that come in through the door. Is it management of diabetes? Is it high blood pressure? Is it weight management? Is it what is the main things that you are seeing there? So that you go and research, so that you're not coming in the dark. You're showing up without knowing what is going on. So yes, when the preceptors give you some assignments, don't neglect that, because they're trying to test and see how committed and how knowledgeable you're trying to be, or how you want to learn the job and learn to be a nurse practitioner. So go ahead and research on some topics that you are not familiar with. Also, in this job, working as a nurse practitioner, you have to develop critical thinking skills. As a nurse, I'm sure you already got your critical skills down pat anyway, right? So make sure that you develop by analyzing situations, making sure that you are doing good assessment. Because sometimes you have cases where patient come in, they're telling you, okay, my blood pressure is very high. Yes, your blood pressure is very high, but then as you are assessing them and also asking questions, you realize that for the past 3 months, they haven't taken any medication. Or because either there's lack of funding, or they lost the insurance, or they were too busy. So you want to make sure you get all that information, so that you don't just say, okay, what? Oh, you are on 10 milligram on Lodipine. Let me go ahead and add something to that because it's not controlling your blood pressure. Well, the patient is not taking the medicine, right? So you want to always listen and be critical when you are taking care of patients. Or they're eating junk food. They are not exercising. They are not doing other things, to help that blood pressure come down, to reduce. So you want to make sure that your critical thinking cap is always on when you are dealing with patients. How about your effective time management? You are working, you are precepting with a nurse or a doctor for your preceptor rotation. So you want to be very time conscious. When they say, I need you to go check on that patient, you want to make sure that you're going to finish up, do your documentation, or do whatever you need to do. Come and give them the report so that you guys will go to the next patient. You can't be wasting time. You can't keep taking breaks, or smoking breaks, or breaks and things like that, right? You want to be productive because your preceptor is also being productive. The funny thing with preceptor or clinical rotation is that the shocking thing at most places is that most of these doctors will still have a full load, or the nurse practitioners that are going to precept you as a student has a full load. So they are also constantly under a lot of stress. So they want you to make sure that you are conscious of that. And then encourage self-reflection. And what that means is that at the end of the day, so how did I do today? What could I have done different? What could I have done better? Because mind you, you are learning to be a professional. You are learning to practice independently. So when you come for your clinical, this is a good time to learn. It's a good time to do some self-reflection. Look in the mirror every day to make sure you are being honest with yourself. If your preceptor complain about something, don't take it personal. Like I said earlier, do not take it personal. Just try to get a good hand on what is going on so that you be a very good nurse practitioner. The other thing is always make sure that you are paying attention to ethical practices. So don't go and start getting involved in things that are ethically wrong. Okay? Also, ask thoughtful questions. Like I said, don't waste your preceptor's time. Simple things. So what did the patient eat yesterday? How is that affecting their diabetes? Well, or if the patient didn't take the medication, how is that affecting their blood pressure? There are some things that you need to just check on your own. Oh, what is the hemoglobin A1C that I need to know to diagnose someone with diabetes? Don't be asking preceptors those type of questions. You ask constructive questions. You don't want to start making them feel as if you don't know what you've done or what you are doing, or you didn't learn anything in your nurse practitioner school. And so make sure that you own the clinical rotation. This is the time for you to learn. So you come with an open mind, open attitude. Make sure you're paying attention to what the preceptor is saying. If she said, okay, we'll leave for lunch at 11, come back at 11:30, then you do so. If she said, I would love for you to be here at 7 o'clock in the morning, then you do so. You want to be very professional, very attentive, because this is the area where you are going to learn a lot if you jive and if you are in good mode with the preceptor, because you will learn a lot. Anyhow, what are some other ways, those of you that are, when you watch the video, let us know what other ways you were able to succeed. What are some of the tips that you can give others as far as succeeding during your clinical rotation? Okay, so don't forget to subscribe, come back and for more good stuff on this channel. And also remember, always practice gratitude every day. Have a nice day. Bye-bye.